Hello, my name is James Smith. I'm an associate professor and professional engineer at the Lassonde School of Engineering at York University in Toronto, Canada. And today I'll talk about grassroots advocacy for improved air quality during a pandemic. We'll begin with science communication. Why do we care about it? First, it's good for institutional reputation. Second, it's because it's good for student recruitment. Then it's good for hiring of faculty and staff. And also, it's good for obtaining grants, whether directly or indirectly. I am a consumer of science. I typically read, process, distill, and share science in my classroom, but I can also do it, and I do it, within the public sphere as well. I am a science consumer. I am a science regurgitator. Next, I want to talk about more specifically air quality. Air quality is important in general because it's good for our health, but during COVID, it's important because COVID is airborne. It is in the air, and when we deal with it as an air quality issue, we can deal with it better. But air quality is important for learning. It's good for general workplace health and safety. It's good overall. We need to do better with air quality. Let's talk about some examples of science advocacy related to COVID and the pandemic and airborne nature of COVID. Here is an article or an excerpt from an article in the British Medical Journal. In the upper left, it says things are good. In the bottom right, it says things are bad. And I tried to show my kids this. My kids yawned and they moved on and they didn't understand what this was about. So I added icons to it to show that if we can have low occupancy, better ventilation, more masking, and less loud talking, then we would have a better environment, safer against COVID. Conversely, if we have poor ventilation, etc., it's worse for us, it's better for the transmission of COVID, which we don't want. My kids got this. They got the icons, and that was important here. I adapted to my audience. Next, little conversations, big impact in the context of school buses. My kid's school bus had the windows closed. So I spoke to the driver and I said, hey, I want you to be safe. I want my kids to be safe. We're supposed to have the windows open in the school bus. And there's this paper. Well, I didn't actually talk about the paper, but you and I know that there are papers out there that talk about computational fluid dynamics in school buses and how having certain windows open maximizes airflow. That's a good thing. All I needed the bus driver to know is that I wanted him to make sure the windows were open. And ever since, the windows have been open. HEPA filters, HEPA air purifiers in the classroom. A number of school boards have obtained these and put them in the classroom. The problem is they're not always used the best way that they can be. Here's an example of a HEPA air purifier in my kid's school. And you can see that it's not being used properly because the sides have to be free, the top has to be free in order to take dirty air from the sides and push it up through the top vent. What we see is that the sides are blocked, the back is blocked, the front is blocked, and there are papers on the top preventing clean air from getting out. We need to do better. We need to better quantify the air quality in our classrooms. We need to better train our teachers. We need to verify that they're being used properly in the classrooms. Really, we got to send in the engineers to make sure that the air quality in our classrooms is good. Next up, commercial off-the-shelf air purifiers are expensive. We can do better for our schools if we also bring in less expensive ones that are, basically made do-it-yourself. Using high-end furnace filters and box fans, we can build what are referred to as Corsi-Rosenthal boxes. These have been demonstrated, they've been quantified, they've been tested, they've been experimented with by engineers and scientists. They work. They are good. And we can get them into schools, into classrooms, into office spaces for cheap to make things better because COVID is airborne. Masking policies can also be changed from internal sources, okay? So if we take a look at the science tells us that cloth masks are not very good if we're trying to prevent infectious doses of COVID. All right. So if everyone's wearing a cloth mask, you don't have a lot of time before you can potentially have an infectious dose. On the other hand, if everyone's wearing N95 masks, even if they're not professionally fitted, we can go for hours before the potential infectious dose. This is good. This is important. We need to move to N95 masks. Now, when I've brought up these issues with our administration here at the university, I got one of these kinds of letters that basically said, we are following public health guidelines and you should go to the website. Well, it turns out the masking policy on the website is not very good. And we can do much better than public health. So to that end, I've introduced 4 motions for protecting faculty, staff, and students within our department, and now up to the faculty level at the Lausanne School of Engineering, for better masking, for CO2 sensors to monitor air quality, and for HEPA air purifiers to clean the air in the classrooms and our workspaces. We can do this. We can make things better without going bottom of the barrel public health. We can exceed those guidelines. We can do better for our community. So 5 examples of grassroots advocacy. I'm going to leave you with this question. Does advocacy work? Well, think back half a year when we were told that we could not have vaccine mandates. Our leadership told us no to vaccine mandates. What happened? Advocacy happened. It works. We know it. Thank you, everyone.